credits do not expire. And Republicans blocked it. Not once, not twice, but 13 times throughout the year. 13 times they voted against our extensions of the ACA credits. 13 times. We tried over and over again. Then we tried 1 year. We tried 2 years. We tried 3 years. We tried everything. They kept saying no. And of course, Republicans had every opportunity to negotiate, to join us, offer a serious plan to prevent premiums from rising after January 1st. Instead, today Republicans voted down the only plan that would have stopped the premium spikes, while having no plan of their own. Until a few days ago, they had no plan at all to put on the floor. They were so embarrassed they had no plan, they said they put a little bubble gum and Scotch tape together and put together a ridiculous, phony plan that simply helps the insurance companies. It was a list of right-wing wish list: more junk insurance, fewer protections, restrictions on women's health care. Their plan, their junk insurance plan, it's called a junk insurance plan, has been ridiculed over and over and over again. And it couldn't even pass the Republican Senate. Today, actually, our proposal got more votes than theirs. Our vote actually had a majority. Theirs did not. Or theirs, no, our vote had a majority and was bipartisan, and theirs was not. After today's vote, the American health care crisis is now 100% on Republican shoulders. On January 1st, premiums are going to go up. All of us have had people crying in front of us, in our arms, saying, what are they going to do when they've cut off the money that pays for my daughter's cancer treatment? What am I going to do? They've told me that my dad or mom is going to be kicked out of their nursing home, which is going to close. What am I going to do when I have to change doctors who I've worked with for years on curing a disease that my spouse has? Well, coverage got a lot harder to afford, and families are facing a lot of impossible, horrible choices. And Republicans owned every bit of it because of the way they voted today. Shameful. Shame on them. They all seem to, so many of them seem to be in a bubble. You know, we know Trump's in a bubble when he calls affordability a hoax. And he says he doesn't want to do anything to help people with health care. They're in a bubble too. The suffering of people is going to be enormous and heart-wrenching. How can Republicans look themselves in the mirror knowing they have to go back home and tell people over the holidays, I voted to send your premiums up, Republicans are going to say. They're going to say they voted, are they going to tell their constituents they voted to double their monthly premiums? Are they going to tell their constituents they voted to kick you off insurance? Are they going to tell their constituents, I voted to get you sick and go broke? Because that's what Republicans did by blocking a clean extension of the tax credits. When families open their health insurance bills in January and see the sky-high premiums staring back at them, they will know. The American people will know that Democrats fought to stop these hikes, but Republicans fought to guarantee that they happen. Republicans blocked the solution. They blocked the backup solution. They blocked any negotiations, no matter how hard we tried. And now the next chapter begins. Republicans will have to answer to the American people, explain to the country why they chose higher health care costs over real solutions. Republicans must answer for why people will lose coverage. Republicans must answer why families see premiums double and triple over the next year. Democrats' focus does not change. We fought like hell to stop these hikes, and we're going to continue to fight like hell to bring costs down for the American people on health care, on housing, on electric rates, on groceries. But Republicans are fighting like hell to send those costs right through the roof. They're fighting like hell to kick people off insurance. They're fighting like hell to cut taxes and give sweet giveaways to billionaires and the ultra-rich. January 1st is coming. Republicans are responsible for what happens next. This is their crisis now, and they're going to have to answer for it. Senator Klobuchar.
All right. Thank you very much, Senator Schumer. And this is it. 13 times, not their lucky number. 13 times they rejected this. 13 times with the American people. So when that farmer, soybean farmer in Minnesota, says to me he sees nothing but a perfect storm of ugly because of the tariffs, because of the input costs for his farm equipment, and because of his health care premiums, I'm going to tell them 13 times we tried to do this. You have already seen how the public feels about this, whether it is the Virginia and the New Jersey governor's races, whether it is the statewide Georgia races, including a recent legislative race there. They said enough. They want us to be working together to do something about their health care. And we have given them the opportunity so many times. The straight extension. And we would like to do a lot more, believe me. Reverse the cuts from the big, beautiful betrayal of the bill when it comes to Medicaid. Do something more on my legislation for negotiation of prescription drugs so we could do that faster. Public option, you name it. There's a lot of choices here. But right now, we have an immediate crisis. And as Senator Schumer pointed out, this is not a January thing. It's going to be set by then. This is not a February thing. This is a now thing. And they not only rejected this 3 years, despite 4 of them, including a very conservative Republican voting with us today, they also rejected a 2-year. They also rejected a very clear vote on a simple 1-year extension that basically would have been the same amount of money as they sent to Argentina. So I don't know how they explain to that soybean farmer in Minnesota that it was more important for them to send money to Argentina for one of the president's buddies than it is to help people with their health care. 75% of the people on these plans are in red states. They're in states that Donald Trump won. So I am not surprised that 4 of our colleagues voted with us. What I'm surprised by is that we didn't get that extra 9 that we needed, who behind closed doors, or as you've heard talk in the House, know that we have to do something about this right away. Senator Schumer and I have heard from so many people in our states and throughout the country. Here's one we just heard from yesterday, Virginia. Aaron and his wife, cancer survivor, are going to see their premiums double. That means they're going to have to make some hard choices. Do they pay the high premiums so Aaron's wife can continue her cancer screenings, or do they get some kind of junk plan so that maybe if there's a catastrophe it gets paid for, but the ongoing help is not there? Becky was in a wheelchair who's making progress, and they predict she's going to be out of that wheelchair if she can finish her treatment and physical therapy, but she doesn't think she can afford the premiums. Throughout the country, the people have spoken out. And one state where this is key, when you look at the states that use the most of these plans, it is Texas, it is Florida, and it is the state of Georgia. And just by coincidence, we have the great senator from the state of Georgia, Raphael Warnock, joining us today.
A happy coincidence.
Thank you so much, Senator Klobuchar and Leader Schumer. After today's vote, I really only have one question. Who do the Washington Republicans work for? Who are they working for? First, you kick 15 million Americans off of their health care in order to give billionaires a tax cut. And then after doing that, you double the premiums on some 22 million additional Americans. For some people, you triple the premiums, quadruple the premiums. Who are you working for? These are people who are disproportionately in red districts. And we have tried time and time again, as my colleagues have said, to get the Republicans to make a different choice, and here we are today. 15 million Americans have lost their health care. 22 million Americans on average will see their premiums double. Just last night, I had to stand up and object to a UC that would have knocked an additional 1 million people off of health care. And my colleague who was putting forth that proposal, like me, he lives in a state that has not expanded Medicaid. And so here we are. The Republicans have demonstrated who they are working for. Certainly they're not working for you. They are not working for the people of Evans County, Georgia. I was there a couple of months ago. This is a county that voted overwhelmingly for Donald Trump. I won Georgia. I did not win that county, but I was there because I represent those people. They've already lost their labor and delivery unit, and they may well lose their ICU with these draconian cuts to health care. And so we've got to find a better way forward. We know that the status quo certainly has its problems. There's nobody who's saying that health care in America is terrific. But Republicans today have taken a system that's already struggling and broken it down even more. And the consequences for ordinary people, many of them in their own red districts, will be that they will have to delay response to their health care. They will have to find a way to pay more, higher premiums. And for many people, they will literally pay with their lives. And so we're not about to give up. We're going to keep fighting for those people. I've gotten arrested not once but twice fighting for health care. Dr. King said of all the injustices, inequality in health care is the most shocking and the most inhumane. And we're going to keep working at this until we center the people and get them their health care and their human dignity back.
Okay, questions on this subject? Yes.
Leader Thune says you're making this a political issue. These votes on the floor make it clear that a clean extension does not have a path forward. Neither do just reforms without an extension. So are you open to both?
Leader Thune ought to start talking to the American people. When your health care premiums double, when you can't afford medicine, when you have to switch doctors who's been on your case for so many years, that ain't political, John Thune. That's humane, and that's democracy, doing what the people want. Yes, yes, next.
The healthcare debate was at the center of the government shutdown. The government was shut down over this issue. Do you have any regrets about how you handled this issue, given that you knew likely this kind of vote was going to fail?
The bottom line is nobody wants a shutdown. And when the Republicans wouldn't talk to us, it was their shutdown and the people see it. But we are going to continue one thing that happened. The health care issue became front and center. The American people saw who was on their side and who isn't, and we are going to keep fighting as a unified caucus to get better health care for the American people, as Reverend Warnock said, plain and simple. Yes, next question. Look, the Republicans voted against this 13 times. The onus is on them.
Yeah.
Yes.
When I talk to the Republicans, they keep coming back saying, well, this is representative of Obamacare failed. What do you say about that, saying that they're just trying to extend this, trying to
Yeah, speak to the,
failed program?
you know, they're in their own political bubble. They're so ideologically wrapped around this axle. Go talk to the people. 55% of Trump voters want us to extend the ACA. The American people want this in red states, in blue states, in purple states, northeast, southwest. It's universal. Look at the election results. Look at the election results from one end of the country to the other. The Republicans try to call it political because they don't have an answer. They're busy fighting with each other. They got 15 different plans, none of which can get close to a majority of support in their caucus. Yes.
Republicans have cited the fraud, and they point to this Government Accountability Office report that came out recently, in which they have submitted a bunch of the applications for the ACA subsidies, and 90% of those were approved. Why do you guys not want to address the fraud as part of a compromise that is a potential path to doing it?
They have not, there is no compromise when both Leader Thune and Leader Johnson say they're totally against extending the ACA credits, which is going to come crashing down on people in 20 days, and they say they are not for it at all. Okay? That's the bottom line here. Yes.
A number of Senate Democrats have said today that it's hard right now, given the noise around the opportunity to come together and have a bipartisan conversation on healthcare, what opportunities that?
Well, look, first of all, you know, the toothpaste is out of the tube. Once January 1st comes and everyone is locked into their insurance proposals, you can't put the toothpaste back in the tube. They want to talk about health care in general and how to improve it. We're always open to that. But do not want what they want, favoring the insurance companies, favoring the drug companies, favoring the special interests, and turning their back on the American people. Okay? We'll take the last one.
In the House, there is an effort for a discharge petition, and that is getting Republican interest on the House side for a one-year extension. There's a couple different options. The timing on that is a little tricky, but.
Oh, yeah.
Right, to say the least. But in theory, if the House manages to bring up a one-year extension, would you want the Senate to come back?
Let's see I'm not going to prejudge what the House does. Let's see if they can pass anything. Right now, Johnson has said he's against any extension of ACA for 3 years, 2 years, 1 year, 12 months, 10 months, 8 months, 1 week, 1 day. He's not for any of it.
Even with some of their reforms.
But
Senator Schumer's office has been open. I know, I walk in there. The door is open for them all this year. Over and over. We proposed a one-year plan,
Yeah,
and they turned it down. We had them vote on it. So this idea that they suddenly, in the last minute, more power to them. But if they're going to come forward, then they need to get unified come forward. This is not happening.
The discharge petition and the fact that we got a bipartisan vote here today shows you that they're on the wrong side of the issue, that the American people, their own constituents, are with us. And we're not asking them to stand with us. We're asking Republicans to stand up for their own constituents.
This is such a crisis, and they're busy playing games. And you can see where the votes are in the country and even here in the Senate. We're getting some bipartisan support for our proposal, but the leadership of the Republican Party and Donald Trump are against any extension of ACA credits. And after January 1st, as I said, the toothpaste is out of the tube.
They care more about pissing off Donald Trump than they do their own constituents.
Have you guys talked to the president? Have you called Donald Trump?
He has called.
Yes, I have. And when we talked to him, he said, I need a whole new ACA.
When was that?
At our meeting. At our meeting.
No, this wasn't be clear, this wasn't a separate phone call, Leader Schumer.
No.
Since
That was the
September-
last.
That was at the.
Come back and explain, this is important, Senator Schumer.
Yeah.
I am talking about when Hakeem and I met with him.
In September.
Yes, and since then, all his public statements have said he is not for extending the ACA credits. Once he began to say it, and then he retracted the next day.
And instead of spending this week working on this or last week,
Yeah.
he's going off saying that affordability is a hoax. This is not a president that's coming to try to find any kind of a compromise or work with us on this, and the American people see right through it.
But so do they have to wait a year until something happens?
Ask them.
Ask the Republicans.